Hi, my name is Stephanie Lowe, and I'm here to talk to you a little bit today about using a spacer with inhaled medications. There's a few reasons that you really want to use a spacer when you're doing inhaled medications. One of the big reasons is that when you're trying to do an inhaled medication, you have to make sure everything's working together. And sometimes that's really hard for really young people or older people or just people like me who are just not coordinated. So you want to it's hard to get the puff and the inhale all at the same time to line up correctly, so you're making sure all the medication is getting in. The second reason that you really want to use a spacer is that the medication needs to get into your lungs, and that's not going to happen if it gets stuck in the back of your throat. And sometimes the force with which the medicine comes out, it can kind of prevent it from getting to where it needs and might get stuck. I know my kids have really big tonsils, and it's hard to get it back and down into where it needs to go. So a chamber helps with that. So most spacers or chambers look the same. They have the mouthpiece, they have the chamber part, and then they have the end. Most of them have a universal end so that any of your inhalers can fit onto it. So you just want to make sure that inspect them, make sure the seals are tight on them. And then this is my son's, so it's smaller obviously, and you can make sure it fits around the nose and the mouth. Now when you're caring for your spacer, there's a few things that are key to remember. It comes apart in a few different pieces. With the main part of the chamber itself, you want to make sure you don't scrub it, because there is an anti-static film coating on it that makes sure the medicine doesn't get trapped in there and stuck to the sides. So if you're rubbing and scrubbing it, then that's going to wear off. So really when you're washing this, what you can do is kind of run it through warm soapy water and then rinse it. Like I said, you don't want to scrub it, because then that's going to take away the anti-static property, and then some of the medication might end up getting stuck on the tube. And then with the mouthpiece, you can wash it normal soap and water. Sometimes if kids are having a hard time dealing with the mask, I've heard of people putting a little bit of chapstick or something to make it smell better, just to kind of play a game, putting stickers on it, like a lot of times they do when kids are having surgery. So those are a few different things with the chamber. Again, it's really important to use them because that is one of the best ways to make sure all the medication gets to where it needs to go. Last thing with cleaning is that you can run these through the dishwasher if you need. You shouldn't do it all the time, but once in a while if it needs a really good cleaning, that is okay. Again, always check with manufacturer recommendations for your specific chamber. Again, most of the ones that I have seen, that is okay once in a while. So that's a little bit about care and usage of a chamber. Thanks.